I think back to when we did our first interview with you back in like 2000 during lockdown. And you were in our
Yes.
basement, and look what's happened since then. And you've done so much since then. I mean, you've written two books
Right.
since then, and your latest is coming out October 14th. It is the Perimenopausal Survival Guide. And
Yep.
make sense of your symptoms and build your personalized treatment plan. And I said to you earlier before we started recording how I wish so badly something like this was out there when I was going through perimenopause because I was so lost. I didn't know what was happening. What made you feel that this, just the importance of right now sharing these stories?
I jokingly have been referring to perimenopause as menopause's little sister. And some of my patients called it menopause's evil little sister. And, you know, really, menopause has definitely had its moment, and it still is. To say that it's over or that we've exhausted the topic, I don't even think we're there yet because there are still millions of women who are just now learning about it. But at the same time, women who have, are still having periods, have not gotten to that final menstrual period. This can span an entire decade. This can be a woman's whole 40s. This could be from 37 to 47. And a lot of similarities exist, but enough differences exist that if you were in your 40s, you might have no idea that this was hormonal. Because it's easy to think menopause is for your mom or your grandmother, right? It's easy when you're, not there yet to think it's so far off. Of course, we know it's not. And time is this, mysterious little thing. But I really wanted to help women, even before they got into the throes of menopause, understand what could be happening to them. And I know you guys are, interviewing just incredible experts in menopause. Um, and the sooner women can start to piece together how important those little sex hormones are, that they do so much more than just allow us to do breast milk and reproduce. They're really actually functioning from head to toe, from the brain fog to the cardiovascular system, the bones, and etc. The earlier they can see what hormonal impacts can really change their health, the better. And so I had so many women read my first book and kind of say, no, and I think on this, I think, and I kind of tell they felt a little lost. And I realized they were in perimenopause. So the menopause type didn't make any sense to them because they were not yet in menopause. They were in the throes of perimenopause. And so that's kind of why I really think that it's having its moment. It's adjacent, but it's still different enough. And it's now including women who may have not heard the term menopause and may not be in the quote menopause movement to really realize what's happening. So, we're starting to think about the women who are in their 30s and 40s who've never heard these terms before and trying to educate them now.
You have to understand that menopause is when your hormones are lower, but kind of stable at that point. Perimenopause is when you're on the roller coaster ride of hormones and you don't know what day, because I think there are women out there that think, I'm just going to go get a blood test and whatever my hormones are, I'll know from there. So I love that you really talk about that in the book. And could you explain it to our listeners a little more?
Yes. So this is kind of the hormonal havoc that happens in this stage. And there's a couple things that are happening. So you're right. In menopause, they're low and they're steady. In perimenopause, your estrogen, it's lowering, but it's also very volatile. So it's bouncing around. This is why you can have breast tenderness and cry at the drop of a hat one moment and then feel like the Sahara Desert the next moment. Like there's just sort of no rhyme or reason. And it can really make women feel, you know, like you're going crazy. And I hate to say that because I do not think that that is what's happening. But as someone who has now experienced this herself, I get that feeling of like, what the heck's happening to me? And the progesterone's also just beginning to lower. So this is when anxiety and insomnia can spike. I have had my first experiences of perimenopause. Even just the last week, I've woken up, I've had the 4 a.m. awakening with anxiety for no reason. No reason. I think maybe my sleep's getting a little lighter because my progesterone's declining. And so I'm thinking and I'm waking up and I'm like feeling anxious. And I just kind of hold my heart and hold my belly. But with perimenopause, because so many women are experiencing this hormonal havoc, they're still bleeding and their doctors say you're too young for menopause, they're thinking, do I need to go to a psychiatrist? Do I need to get on antidepressants? Do I need to, do CBT? Do I need to see a sleep medicine specialist? Do I need to see my primary care? And that's kind of how this whirlwind then starts to go. And it could be for many women the first time that they're actually utilizing the healthcare system outside of pap smears and babies. And it can be really scary. You both probably remember. And that's what perimenopause can lead to if we don't know what hormonal havoc is happening is misdiagnosis and mistreatment, or maybe overtreatment or undertreatment or the wrong treatment. And it's such a big deal. But again, menopause can be crystal clear. Okay, no periods in 16 months. This could be menopause. Even a doctor who is just learning about menopause, because we've been talking about it, can piece that together. But perimenopause can be such a different beast because of that hormonal havoc. You're still having periods, and sometimes they're heavier. Sometimes you're missing them. I actually joke that like one of the ways you know you're in perimenopause is you get a pregnancy test, even though you know there's no chance you could be pregnant. Your partner's on the other side of the room. You haven't seen them in 2 months, but you're like, why did I not get a period? This is your entry into perimenopause. There is a myth that lab work is helpful or that it will solidify a diagnosis. Now, both of you have been in this field getting your your MD degree. And so you both know, of course, there's no lab test that would rule in or rule out perimenopause, but it's important to say again, because we've got a lot of direct consumer lab tests or companies that are trying to help women diagnose themselves, but a lab test can't diagnose you with perimenopause. Now, I might still check labs for my patients, and that's individual, and that might help us kind of get more data. But that's a big myth that lab testing can tell you if you're in perimenopause or not. And a lot of clinicians will actually perseverate that myth. Another big one is that you're too young. This myth drives me absolutely bonkers. And I see women in their 20s, 30s, 40s, 50s, 60s, 70s. Now, there's lots of reasons I see younger women. Sometimes I'm seeing them now for PMS, PMDD, which is PMS on steroids, PCOS, infertility. I mean, most of the time I'm doing perimenopause and menopause, but you can have perimenopause early if your menopause is early. And so there's no such thing as you are too young. We have average ages because we need to know average ages as physicians. Protocols can be helpful, but the more we're learning about this topic, the more we realize maybe the average is even not correct. And so you can never be too young. So, to that point, it's to always like to be actionable. Start journaling and tracking if you're even either a woman in perimenopause or you're in menopause, but you have friends, colleagues, girlfriends who are in perimenopause. Start journaling and tracking your periods and your symptoms, what makes them better, what's making them worse, i.e. red wine and all the things that we normally like. But that actually gives you ammo to say, I'm not too young. These symptoms are real. These are happening. And so that's another myth that really bothers me. And then lastly, that you have to wait until menopause to start menopausal hormone therapy. Now, the term, of course, is confusing, right? It's menopausal hormone therapy. And here's Dr. Hirsch saying you can use it. But that's a big myth. So a lot of women are left to suffer. Their doctors are told, well, we can't start that until it's been 12 months of no period. That could mean X years of absolute, tornado of symptoms. And that couldn't be farther from the truth. So I do spend a majority of the book kind of breaking that down and how I do prescribe menopausal hormone therapy. I was very clear on those definitions at the FDA panel. For women in perimenopause. So that's just the tip of the iceberg. There's 3 myths that still really bother me.
A lot of women don't know which symptom is the worst. Like, they're having 3 or 4 symptoms. It goes into different categories. And you talk about the 75% rule, which was really helpful in reading it. But can you talk, because women are going in with these, sometimes they think unrelated symptoms, but they're actually very important to note.
hmm And the way I kind of do this and the way I was really encouraged to write it is what do you do with your patients? Since I still see my patients every week. In fact, I saw two patients today. And so what I really kind of help them do is first think about, is there one symptom where if you think that's better, it could potentially help ease up the other symptoms? So for a lot of women, it's sleep. They'll say, you know what? If my sleep gets better, I bet maybe my mood would get better, maybe the less brain fog, maybe less snacking, maybe the weight. And we're like, okay, let's hone in on that symptom. So I like to kind of ask them what symptom, if we got better, would help all of the other things. Or another way I'll say this is, I haven't said it in a while, so I'll say, if I had a magic wand, because now most people know I don't, and I could, alleviate one symptom, the most bothersome one, what would it be? And for everyone, it's different. Sometimes they'll say it's honestly the libido and the pain because my intimacy, and then the marriage, and then the fighting, and then the kids. So everyone's really different. So I have them help pick out the one symptom. Then a lot of women who come to me were thinking about using menopausal hormone therapy, or it may not be MHT. That is not the one and only thing I prescribe, but let's use that because we're still kind of on this wavelength. And lots of times we're using this as a diagnostic tool as well as therapeutic. What do I mean by that? Well, let's say they're like, maybe it's the joint aches and pains, and they say, if the joint aches and pains would go away, I wouldn't wake up as much in the middle of the night. I would sleep the night, I would get up earlier, I would go on my morning run, I would see my friends, I would be social, I'd be more productive. And we're thinking, okay, great. But she's thinking, I don't know if this is hormonal. So, okay, that's the first thing. Let's try menopausal hormone therapy and see if it's both diagnostic, it rules it in or rules it out. And if it does, then Colleen, I want my patients who are using hormone therapy to be at least 70 to 80% better.
The four pillars of health.
Yeah.
And how all of this kind of ties into the four pillars of health.
Yeah.
Health. Do you mind sharing what those pillars are and then
Yes.
how that is so helpful in this time?
Yes, and I hear you on the bleeding. And, again, this is a topic that's not in most menopause books because mostly menopause is characterized by your bleedings being done. Now, there is some touching on, bleeding after menopause, but this heavy, heavy bleeding really impacts our health, just like you said, in so many ways. And, one of the other things I'm also realizing as I'm going through perimenopause is it's not just about, treating it's not just about hormone therapy in a way, or it's not just about what's the one medication. I mean, as a clinician, yes, I definitely think about that a lot. And patients often need that before they can start thinking about their mental health and their nutrition, just because you gotta feel at least a little bit better before you start, meal prepping. But it is really about the whole picture. And even at the collaborative, which is the telemedicine practice, we've included wellness partners because my four pillars of health is so important. I even want my patients to experience this. It's not just for my books, it's really how I treat patients, which is just such a beautiful thing. So, the four pillars is your mental health, your nutrition, your movement or exercise, but I like the word movement better, and your sleep. And we really address these holistically, and I address them in the book because once you get to 70% better on your treatment, or that's my goal, you need to also then start including these pillars and forming these good habits now. And that is going to set you up for just, wonderful next chapter. And this is really this crucial moment where we can reform habits. We have a lot of neuroplasticity. As you know, you've talked with Lisa Mosconi. There's lots of neuroplasticity around this time as well. And so it's like a wonderful time to form new habits, get rid of the ones that don't serve us, and add the new ones in.